Very useful. That's 5-HTP. And I'm going to move on from that, from the brain and depression, to adrenal fatigue and exhaustion. And there's a very natural tie-in here. Many, many people are actually having fatigue, adrenal fatigue, exhaustion, and it feels like you keep your body stress-proof. Not stress. A lot of people have trouble sleeping. Anybody here have trouble sleeping? Okay. And this is a big, big issue. And sleep is essential to our well-being. It's essential. And insomnia is so common to many conditions. Anxiety, stress, PMS, weight gain. You can get weight gain from insomnia. Affects 70 million Americans. The direct costs are $14 billion a year, according to the National Sleep Foundation. And then blood sugar. I'm going to talk a little bit about blood sugar, which I mentioned earlier. And what does it feel like when your blood sugar is low? Anybody want to describe it for me?
Jittery.
Jittery, yeah. Weak.
Lumpy.
Can't think.
Brain fog, yeah.
Brain fog, yeah. Because glucose is our brain fuel. When we eat carbohydrates, it's broken down into glucose, and the glucose feeds our brain, right? So, very important to keep our blood sugar level. Then what happens is when you're eating too much sugar, you develop something called insulin resistance, and this is not the topic for today, but I'll just brush on it lightly. I talk about it more in my 8 Weeks to Vibrant Health book. But you develop metabolic syndrome or insulin resistance if you have too much sugar. Not interested, or not interested, you know, like you knock once too often. So you have all this sugar floating around in your blood, and that's very bad. You develop metabolic syndrome, which is a predecessor to what? Diabetes. Okay, so you're going to have a predisposition to diabetes. You're going to have high blood pressure, high blood sugar, high cholesterol, fat around the middle. Not a good thing, right? We don't like that. Okay, so the main thing to deal with this is food. Eat regularly. Do not eat sugar. Don't overdo sugar. If you eat sugar, eat a little bit, have it with a meal. Don't just go eating sugar as your snack. And that's pretty much what we're doing in our culture. People eat, you know, donuts and cookies, and you get the rapid glucose. It feels good, but you pay a really high price for it. So what I like to do for my patients, here's the description of what it does. It makes you fat, it makes you inflamed, it raises your cholesterol, your blood sugar, your blood pressure, and it gives you cardiovascular disease. We don't want any of that. So the solution, we actually have a solution. Now, really, 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 the solution is eating right. But take PGX along with it, and it will really help to balance the blood sugar, balance the sugar that you're eating. And even any carb that you're eating is going to turn into glucose. So having PGX along with it, and you can take PGX in sprinkles, you can have it in a little soft gel. What it does, it's a fiber, soluble fiber. If you take it just before you eat, it expands in your stomach, and it makes you feel full. So you're already going to be eating less, right? And it also slows down the absorption of your food. So you're eating less, it's being absorbed more slowly, so you don't feel hungry an hour later. You know, like with Chinese food, oh, I'm hungry again. You don't even want to eat again. It slows it down to make it nice and gradual, so it'll stick to it's like the food sticks to your ribs. It balances your blood sugar, lowers your cholesterol, binds fat. It takes the fat right that's there in your gut from your meal and just takes it right out. So it doesn't even get absorbed. A lot of the fat just goes right through. And this was a very nice study that was done at the Canadian Centre for Functional Medicine by Dr. Michael Lyons. 29 subjects, that's known as people, 29 people took 5 grams or a teaspoon of PGX 2 to 3 times a day for 14 weeks. They lost an average of 12.74 pounds. These people did not change their diet. They lost an average 12.74 pounds. And actually, I saw the results. Some people lost 5, 6, 7 pounds. Some people lost 20 pounds. So that's the average. That's a very good average. For 14 weeks, 12.74 pounds. Great, really great result. And people really like PGX because it's not a quote weight loss drug or weight loss supplement. It's something that actually does something physiological and helps protect you against metabolic syndrome. So it's one of my favorites. Any question about PGX before I move on? I'm going to talk about sex hormones now. Yes?
How does that fit with people who drink a lot of soda?
People who drink a lot of soda? Don't drink a lot of soda. The sugar in it is bad. If you're drinking diet soda, that's bad. It's equal in it, or sucralose. It's either Splenda or sucralose. All those things are really bad. Okay, they're toxic. In 8 Weeks to Vibrant Health, I actually talked about it and why they're bad. Aspartame is what equals aspartame. Aspartame causes glutamate activity in the brain. It's a stimulant. I've had people think they were whacked out, that they were anxious and that they were going crazy. And I asked them, what are they eating? What are they drinking? Something like 6 Diet Pepsis a day. Stop the Diet Pepsi, and they stop being whacked out. Yes?
What about water? We hear a lot about drinking water. That's beneficial, right? Drinking water?
Oh, water's great, yeah.
Is there...
Water's always good because we are made out of, a very large percent of us is water. And we need water for all the chemical processes in our body. So I'm going to move on. Yeah?
Real quick, since this balances blood sugar, is this something you would recommend for someone that already has type 1 diabetes?
Yes. Yeah. You can use it for people with diabetes, sure. Okay, sex hormone imbalance. First of all, PMS. Very common. I'm just sort of doing this by age. So younger women get PMS. As they get older, they get into perimenopause, then into menopause. And then at any age, you can have endometriosis, polycystic ovary syndrome. And estrogen dominance is always a very item, which I think is a very important thing. This applies to men as well. And the issue is xenoestrogens. Do we know what xenoestrogens are? Have people heard of xenoestrogens? Okay, they are toxic or foreign estrogen. Xeno means foreign. They mimic the effect of estrogen in the body. They disrupt they really disrupt your cells. They can cause cancer. They accumulate in the fat over time, and they can cause breast, ovarian, and prostate cancer. So it's not just men that are affected by xenoestrogens. So it sounds like, it's estrogen, it just affects women. It affects men as well. And some of the very bad effects are infertility, birth disease, excess estrogen. You could just have excess estrogen in your body that's there, and it's normal estrogen, but it's just too much, and you need to get rid of that too. And then there's the toxic estrogens, the xenoestrogens, that you absolutely want to get rid of. So, classified in poisons, okay? And there are a lot of poisons that we ingest. We're breathing them in, we're drinking poisons, we're eating poisons, and the xenoestrogens are just one of them. And in fact, even though I'm talking about xenoestrogens, the D-glucarate is the important thing here, not the calcium. I mean, calcium is calcium, but the D-glucarate supports glucuronidation, where in the liver, these toxins are combined with water-soluble substances and taken right out of the body. Indole-3-carbinol, or DIM, which are from cruciferous vegetables, and they also detoxify the estrogen. And it's called EstroSense. It's actually good for men, too. Maybe we should probably just cover the WomenSense part in the purple color, so guys don't think it's going to make them turn feminine or anything. But it's not. It really is actually great for men and great protection from prostate cancer. So when I'm giving my patients EstroSense, the dose really varies. It can be 2 capsules a day if you have, say, hormonal acne or fibrocystic breasts or PMS. And also for cancer prevention, and for balancing your hormones, for heavy periods. I think 2 is often enough. Sometimes you need 4. And then I give 4 also for people who have endometriosis, polycystic ovaries, or very heavy periods. And the EstroSense, after a couple of cycles, women have reported that they're feeling a lot better because they have detoxified the bad estrogen. And remember, this is also protecting you against cancer, which is a good thing. So that's one of my favorites. And what I'm going to stop there and talk about the hormones, and then just go to some general lifestyle things, kind of a summary of how you need to live to stay healthy. And I think a lot of you know this. It's just kind of a review. First of all, you need to know that the hormones and the neurotransmitters are dynamic, but one has to do. I mean, the really sad thing is that most of what I'm seeing in my practice is caused by our civilization. These are diseases we didn't have 50, 60, 70 years ago. Cancer, heart disease, diabetes. We didn't have all this. You know, we had a little bit of it, a little bit. But what we have now is like exponential. We used to have something that was called adult onset diabetes. Some people had it, you know, it was a big deal. Now we have kids with it. It was called adult onset diabetes. So we're in huge trouble. So we're treating man-made illness. And so that's very sad.